Hi, everyone, and welcome to another episode of TILLY. TILLY is brought to you by the Lupus Foundation of New England. I'm your host, Marissa Zeppieri-Caruana. Many of you might already know me as Lupus Chick. I'm really excited today because we have a fellow Lupus warrior, Daniela Spear. She's been living with lupus for 13 years. She's also an incredible coach. So tonight we want to talk to you just a little bit about her journey, what coaching is, and one topic that I know is really important for people that have autoimmune disease and lupus is exercise. And can we do it? And what type of exercise? And how often should we do it? And what do we do if we're in a flare? We have so many questions about exercise that come up. So she's a great person to speak to. So Danielle, I just want to thank you so much for coming on this episode today.
Yeah, thank you for having me. It's an honor to be here.
Oh, absolutely. I want to kick off with asking you, tell us a little bit about your lupus journey. You've had it now for 13 years, but I'm curious, when did your symptoms start? What were they like? And what was your journey to actually getting a diagnosis?
Yeah, that's a great question. So I think, 15 at the time. I was in high school, and it really just started as like this series of mysterious symptoms, right? As I think most of us can probably relate to that. My hair was falling out. I started developing digestive issues. I had insomnia. I developed a rash across my face and my hands. And this was all over the span of about 18 months. And I think the final straw for me was when I started getting pain in my hands, and I was at school, and I asked the teacher if I could go see the nurse because I couldn't pick up my pencil at school. And that was when I really became a self-advocate for myself. I said, Mom, we need to go see a different doctor. Like, someone has to believe me. Because up until that point, I was going from doctor to doctor. I received multiple diagnoses of different things: alopecia, insomnia, gallbladder disease, acne, right? Things are skin disease are just dismissed as acne oftentimes. So I was just so frustrated. I was fed up at that point, and I said, someone needs to believe me that this is not just all of these random symptoms. This is something else. Something else is going on. And so my mom and I finally we spoke out to my family doctor. I said, I think there's something else going on. Can we do more tests? And so he actually sent us to a rheumatologist to do blood work. And that's when they confirmed that I had systemic lupus, and I was 16 at the time.
Wow. So you were diagnosed really young, and you touch on something that's really important. I think when someone shows symptoms, because I've heard this a few times, like in high school or middle school, which is also when I started to show symptoms, it's not typically the first thing that doctors think of or actually start to do more extensive testing. And sometimes it's brushed off. Do you feel that way?
Absolutely. I was just sent to doctor, and I was being treated for each individual symptom versus looking at everything as a whole. I went through a lot of testing that really drained me as a teenager. There were times where I felt really hopeless and depressed because I felt like no one believed me that something else was going on. It's like, oh, well, you have alopecia, your hair's just falling out, here's some steroid injections. Oh, you can't sleep, well, manage your stress better. I was 15, right? 15,
Right.
16 at the time. And, when I went to the doctor for a skin rash, I told her, I don't think this is acne. It's acne. It's just a different form. Like, okay. And the medication that I was given for acne actually made the rash even worse. It was like my body was like yelling for help, and no one was listening. So, when I reached that point of where I couldn't even function at school, I said, something needs to change. Someone needs to believe that there's something else going on. It's not just, I think at the time I remember my mom saying, oh, your hands probably hurt because you sleep with your hands overhead. And I was like, I don't think that's true, Mom. And it was just, I think, a way to kind of explain what was going on when we didn't know. But I finally had to say enough is enough. There's something else going on.
Well, I'm glad that you spoke out. I think, you raise a point of it's really important that we advocate for ourselves, and we know when something is not right. So if we need to push, a little bit more, or we need to go and see another doctor or a third doctor, to try to figure out what is going on, like it's crucial, because otherwise we suffer for even, a longer period without an answer. So when you were diagnosed, what was it like, give me I guess a snapshot of that first like year or so, as far as medication and treatment, and you're in high school. So how did you sort of manage all of this now?
Oh, thinking back to high school, I think just brings back so many interesting memories. So after I was diagnosed, I remember I was at the rheumatologist with my mom. We were handed a pamphlet about lupus. Here you go. Let us know if you have any questions. There wasn't a lot of explanation. And I'm a first generation American. I grew up in a Colombian household. So there was definitely a language barrier between my parents and the doctors. So I think that, being a teenager, I didn't know what to ask. My parents likely also did not know what to ask. So we didn't ask a lot of questions, to be honest. It was a sort of like, okay, I have lupus. This is a medication I need to take. Okay, that's as far as that went. And a couple of months after I received my systemic lupus diagnosis, I was also diagnosed with lupus nephritis, so a lot of kidney involvement. And when I went in for a biopsy, the doctor told us, your kidneys are really angry. We're going to need you to stay. And I went into 6 months of treatment with and chemotherapy. And those 6 months were, I think, some of the most like marking 6 months of my life. I learned a lot about what feels good to me, what doesn't, how can I push myself, how can I not. I think being in high school and wanting to participate in school activities and school sports, I definitely pushed myself more than I should have. And just the whole like part of going through chemotherapy or that kind of treatment at school was really different. I remember walking to class one day. Got to school early. There's like a group of girls just like talking amongst each other, looking at me, and they were like, do you have cancer? Why are you in chemotherapy? And I was like really embarrassed because I didn't know how to explain lupus to them, because I also didn't really quite understand it myself. And I think one of the most like embarrassing stories I can remember is like going to the bathroom during chemotherapy. I had to just go to the bathroom a lot. We had to drink a lot of water, and there was just there's a couple of girls in there, and I remember them saying like, "Dang, is she pouring a bucket?" And I immediately stopped. And it's those stories like that I think really mark you and make us feel almost embarrassed to talk about having lupus. And so for a long time, because of that, I didn't share my story. I didn't talk about having lupus, and I did what I could to ignore it, to be honest. I didn't treat my body very well. I pushed myself more than I should have, as I mentioned. And it was just a time of like shame almost that I encountered. And it wasn't really until college that I began to see that, I should talk about this, because there are a lot of people that struggle with autoimmune diseases, and being embarrassed by it doesn't help, right?
Right. And I think you're sharing something that so many people here can relate to. I hear this story often, and I also share it as well. The first few years I was diagnosed, I told no one, because the few times I had mentioned it, I was, I got these looks and I got these questions of, is it contagious? If I'm dating you, am I going to catch this? And, because I was in my 20s, and I, like you, I didn't really understand it. And there wasn't as much, I'd say, awareness back then. So, people were really not familiar with it. I feel like they're getting more familiar with it today. But when you're younger, it's hard to explain it to other friends that are your age that are perfectly healthy, right? And it's very hard concept, I think, for them to understand when they've been healthy and they haven't had to deal with any medical issues. But like you said, you know, having that shame and that embarrassment, I don't think it's abnormal, but I do think that it sort of makes us stuck for a little while, and then we lose out on time, right? We lose this time of being an advocate, of advocating for ourselves, of reaching out to others and actually helping other people. But in that time, we are learning, we're growing, we're learning more about ourselves, we're learning more about the disease and how to take care of ourselves and what it does to our bodies. So you go through this period, and here you are now today, where you actually help other people. So rather than not say anything at all and not let people know that you even have lupus, you're completely out there and you're helping other people. So tell us a little bit. One, tell us about that transition, but two, also explain, like, what is a coach? What is a coach's job? Like, what do you do?
Yeah, it's a great question. So in college, when I realized I was no longer participating in sports like I did in high school, I started to exercise, and exercise is a little bit different than participating in sports. And I found that with exercise, it became a way for me to not only manage my symptoms, which is the good part of it, but it also became a way for me to have and feel a sense of control. And I think that that's something us lupus patients, any autoimmune patients, like deal with is wanting to have a grasp on some kind of control when our bodies are out of control, right? Um, and so I became really passionate about exercise. I was always really active. I was majoring in exercise and sports science. I became a personal trainer in college, and I used exercise as a way to manage my disease symptoms. And I felt very empowered by exercise. But it wasn't until after college that the transition really happened for me from a very holistic perspective. I was, I think, 24 at the time, and I had been on prednisone for about 9 years at that point. And I remember feeling like, yeah, I'm too young for my bones to be hurting. Like this is so hard. And I tried in the past to get off of prednisone. My body reacted and it wasn't successful. And so this is when I started researching more about how food and our diet and our lifestyle plays a huge role in our disease activity, right? In the progression of our disease. And so I implemented the autoimmune paleo protocol, which is a variation of the paleo diet. And I did that for 3 months, and I slowly started weaning off of the prednisone, and I was successful. And I was like, wow, this is amazing that food has such a big impact in how we feel and how our body works and how we manage our autoimmune disease. And so I combined exercise with that healthy diet, and I realized, like, this is really powerful. This is really impactful. You know, I by nature am a leader, and I really enjoy coaching people, but I felt like I found this like secret key to health and wellness for individuals. But what I also didn't realize at the time was that there's this whole other piece to it of mindset work, of mindset and spiritual work that is really like the icing on the cake. And I often joke and say that I feel like I found the steps backwards, because now in my coaching program, I actually coach my clients through mindset first. Then we get into the diet and exercise, and then we talk about taking responsibility and owning our health. So you asked a question about, you know, what is coaching? How can coaching help someone? So coaching is a guide. What I often encounter is individuals looking for answers and want someone to tell them, what do I need to do? How much do I need to do it? For how long? What do I need to eat? I don't know. If you ever encounter a coach that's going to tell you exactly what you need to do, they're just after your money. a genuine coach is going to help you find the answer that's right for you. So that is what I do with my clients. I guide them. We dig deep into, the root causes of what is actually going on in your body. So in my program, the Remade Wellness Method, I walk my clients through 3 different phases. That first phase is revive. We work a lot on reviving your mindset. So we identify what causes stress, what causes chronic pain and inflammation for you. And we work on techniques, meditation, breathing techniques that help you have a different relationship to pain, which is often a barrier for individuals wanting to exercise, for individuals with autoimmune disease that want to exercise is, well, how do I exercise when I'm in pain? That's why it's so important to first work on the mindset piece of it, establish a different relationship with pain, and see it not as something that needs to be covered, but see it as a messenger. How do we work with it? How do we work with your pain and work with your autoimmune disease to reach a healthier lifestyle? And then we start getting into, let's start changing up some of the lifestyle aspects. What are we feeding our body? How are we moving our body? And then we can talk about taking ownership of our health. And so we start to identify, where are we maybe letting our autoimmune disease or our lupus take control. A really easy example to talk about is waking up with a flare, right? We feel fatigued, we feel tired, we experience brain fog, our joints are achy, maybe we're moody. And those are just very common across any autoimmune disease as a flare-up day. But those are actually the same symptoms as dehydration, right? So I think often as autoimmune patients, we like to place the blame on our autoimmune disease. We wake up with a pain. It's like, oh, it's lupus. Are we sure? Right. So I help guide you to identify, like, what is actual autoimmune disease activity versus lifestyle and things that you can control. We can control dehydration. We can take on better practices to get better sleep, to hydrate, to eat well, to move more. And so we focus on things that you can control.
And I think you bring up a really good point, because even if we just talk about stress, which everyone has, just having a chronic illness is stressful. But stress on its own can cause so many physical manifestations in the body. So, even for me, sometimes I have a hard time differentiating. Like, I've learned more now, obviously, in 20 years of having lupus. Okay, this is because I have way too much on my plate right now, and I'm not taking any steps, for any self-care, or I sort of put myself on the back burner. You're like running at, 100 miles an hour. So know that you're eventually not going to last that long. So it's most likely stress versus lupus. So I like that you try to tease those things out first. And also, I think, I love that you said that you work on mindset, because I don't think it's something that you just know, just from when you're born, right? And especially if you get a diagnosis young. But it's sort of something that you have to be really intentional about, is how you speak to yourself. So if I speak to another advocate or another lupus patient, I want to encourage them, and I want to support them, and I want them to feel like they're not alone and they're going to get through this. But sometimes I wouldn't even talk to myself that way, right? Like, we can be really hard on ourselves. So I love that is the first place that you start.
Yeah, it's amazing how we don't recognize the impact that our thoughts have, right? Our brains operate in this thought, feeling, choice method, right? So there's always first a thought, then you experience a feeling from that thought, and then you take action based on that feeling. So if our thoughts are more often than not negative, you're going to have negative feelings, you're going to take a negative action. And so that is what I help my clients identify is, we start digging in deep to those feelings. We identify what thought is preceding that feeling and how is that showing up in our actions, right? So we work to break all that down, because we often don't realize that we're operating from a very negative thought perspective. And it's understandable, as chronic illness patients, as autoimmune patients, as lupus patients, we often go through a journey that is very negative to get to our diagnosis, to get to an answer. We experience doctors telling us that we're hypochondriacs. We experience our friends and family not understanding. We experience a lot of hopelessness. So often the thought is, I have to fend for myself, right? And so that causes a lot of hopelessness, feelings of sadness, depression. And so we take actions that correlate with that feeling of, I have to fend for myself, right? We don't seek help. We don't talk about what is going on because we have this belief that no one can understand us, that you're the only one that can figure this out on your own, when that's not true. There's a huge community of lupus advocates. I think we just have to find that, but we first have to assess, what feeling are we experiencing and what thought is that coming from?
Absolutely. I love that you really dig into that. And thank you for sharing about that. I want to touch on one more thing. So we
Sure.
talked about exercise, and you did mention, like, we all think about exercise, but if chronic pain is an issue, exercise is the last thing that you want to start doing. But
Yeah.
we know that some movement, we should all have some movement in our life. And, I think it also depends on where are you in your lupus journey. Are you in a flare? How severe is the flare? Depending on, because there are times that my exercise is, 5 minutes. And then there's
Mhm.
times that it's maybe 30 minutes. And it's all based on where my body is at the time. So sort of just give us like a general idea of how someone can incorporate different exercises into their life depending on where they are in their lupus journey. Like, how do you work with someone on that?
Yeah, that's a great question. So I think the first thing is, as you said, recognize where you are in your lupus journey. I often find that as adults, we have suppressed our ability to listen to our body. And so oftentimes we don't recognize, is today a day I can push myself a little bit more, or is today a day that I just need to stretch in my chair? Right. And, it's a full spectrum. Um,
Right.
so, what I would say is, for someone that is maybe struggling to implement exercise, I want to encourage you to not think about exercise as we typically do. I think because of the images and messages that we see in the media, we often think like, if I'm not exercising to my max capacity, if I'm not exercising to the point where I'm, huffing and puffing and sweating, then it doesn't count, right? That's not true at all. I want to, anyone listening to this, you certainly have permission to view exercise differently and based on what you need that day, even if it is 5 minutes of stretching. Movement is important. And I will tell you why. I think we often focus on like the physical benefits of exercise, right? The kind of the aesthetics part of it. But what we don't talk about often enough is our lymphatic system. So our lymphatic system is this network of um, very similar to like your circulatory system, and it's all over your body and kind of like these veins and nodes. And it carries our lymph fluid, which carries a huge part of our immune system. And so the thing that is different between the lymphatic system and the circulatory system is that the circulatory system has a pump, right? Our heart pushes blood everywhere else to our bodies. Our lymphatic system does not have a central pump. It actually relies on muscular contractions, movement, to push that lymph fluid where it needs to go. And our bodies are so wonderfully designed that big node clusters that hold that lymphatic fluid are in our most mobile joints. So you think of like your neck, your shoulders, your hip, your lumbar spine. So moving those joints helps to push that lymphatic fluid around. It helps to rid your body of inflammation, rid your body of toxins that can trigger autoimmune flare-ups. It helps keep cortisol levels down by pushing out those toxins and inflammatory agents in our body. So movement is really important for your overall health. I think that if you are struggling to implement it, as I mentioned earlier, start small. I would much rather commit 5 minutes a day consistently than try to jump into this big, 5 day a week, an hour a day program that maybe isn't realistic for you. So start small and master that. So master those 5 movements. Even if it's 5 minutes of movement in your chair, even on your couch. For some of you, it might just even be moving in your bed, and that's perfectly fine. Master those 5 minutes, add on another minute the week after that. After that, add on another minute, right? The goal here is not to be the absolute best by next week. It's to be 1% better every day. Okay, so keep that in mind. If you feel scared to start exercise, start with very gentle movements, a little at a time, master it first, and then add on. Think about being 1% better each day.
I love that outlook. Thank you. Well, you gave some amazing information. The program sounds great. I think everything that you talked about is anyone that has a chronic illness, these are all things that we need to incorporate into our life. I think looking at things holistically, our mind, our food, our nutrition, our sleep, our movement, our medications, our supplements, like it's, when you hear the word like healing, I think it's sometimes difficult for people because we associate that with something that's really fast and very radical. And it's not that it can't be that way, but with chronic illness and autoimmune disease, it's often implementing multiple things and finding what works for you. And over time, finding different levels of healing. But it takes work and it takes time. And I love that you're helping people find all of these things. Yeah. So for people that want to learn more, tell us a little bit about your website and all your social media so they can come and check you out.
Sure. I'd love to connect with any of you listening. If any of what I said resonates with you, I'd love to talk to you a little bit more about how we can work together to help you reduce your flare-ups. So you can find me on Instagram at Daniela.Spear, or you can send me an email at hello@remadewellness.com. If you want to go to my website, remadewellness.com.
Great. And I will put all of the information here in the video as well. So Daniella, I just want to thank you again for spending some time with us.
Yeah, thank you for having me. It's a pleasure to talk with you and learn a little bit about you and just share about some of my story. So thank you for this opportunity.
Oh, absolutely. I'm sure there's going to be a lot of people here that can relate to multiple areas of your story. And for everyone here, I want to thank you for watching this episode of TILLY. Come check us out again next Tuesday, where we'll be talking to another fabulous person about lupus. And I hope you all have a wonderful evening. I'm Marissa Zeppieri. Take care.